In two previous videos, I reviewed the association between frailty, muscle atrophy, poor aerobic fitness with the increased risk of post-surgical complications and mortality. Is there anything we can do about this? Is there any evidence in the science that being physically active or implementing an exercise program before surgery can actually make a difference and lower the risk? The short answer is yes, and in this video I'll review how exercise before surgery can reduce those risks. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York City. I specialize in sports medicine and arthroscopic surgery. Maintaining a physically active lifestyle, meaning exercising, being physically active before undergoing surgery, has been shown to reduce post-surgical risks. For example, there was a study of about 169 patients who were undergoing major oncological abdominal surgery. And they had their physical activity level evaluated by a questionnaire. And the researchers picked a cutoff point. Below that point, they considered them to not be doing much exercise, and those above it were physically active. And what they found were those people falling below the threshold had a 5.5 greater odds of mortality, meaning death after surgery, than those who were doing more than that threshold of exercise. And then they also found that those falling below the threshold of exercise had 6.7 times greater odds of being discharged to a nursing facility versus going home. And then they also found that those people who did above the threshold of this exercise, they were about 40% more likely to have a shorter hospital stay. So this study demonstrates how being physically active is really important, helping to reduce some of these post-surgical problems. How quickly you get back up on your feet after surgery, get back to your normal routine, regain your physical function is also significantly associated with exercise and your exercise level before you have surgery. For example, there was a study of 77 patients who were undergoing colorectal surgery for cancer. And they split up the patients and they randomized some to get exercise before and some to get exercise after. And so the group that was given exercise before, they were called the prehab group, where they started 4 weeks before surgery, their exercises, and they also were doing exercise after surgery. The other group, called rehab, only started exercise after their surgery. And so they put both of these groups to have aerobic exercise, sort of moderate, and they had them do resistance exercises, and they were doing these 3 days a week, 50-minute sessions. And they were alternating between aerobic and strength exercise days. And they measured their functional capacity by seeing how far they could walk over 6 minutes. And what they found was that while waiting for surgery, those patients who were in the prehab group significantly improved. They improved their distance that they could walk in those 6 minutes by 25 meters. Whereas those who were in the rehab group, meaning they only started exercise after surgery, actually declined by 16 meters while they were waiting for surgery. Then the second thing that they looked at was the difference between baseline and 8 weeks after surgery. And they also found a big difference between these groups. Those in the prehab group had improved by 24 meters compared to those who were in the rehab group that actually declined by 22 meters. So that's a significant difference between the groups. And then finally, they found that a higher portion of those who were in the prehab group, 84%, were recovered back to their baseline exercise capacity 8 weeks after surgery, whereas in the rehab group, meaning again they only did the exercise after surgery, that only about 62% of them had regained back to their baseline level 8 weeks after surgery. A study like this demonstrates how important it is to start exercise before you have surgery. So again, we're used to that after surgery, everyone goes into physical therapy and they rehabilitate. But this study demonstrates how important it is to start exercising before you have surgery. One of the most common orthopedic procedures that are done are joint replacement surgery, like hip replacement and knee replacement. And here again, studies showed the importance of exercise before surgery. For example, there was a meta-analysis of 3,000 patients undergoing lower extremity joint replacement surgery, and they found that doing exercise beforehand was very helpful for recovery after the surgery. For example, they found that in patients who were undergoing knee replacement surgery, they had significant improvements with better function, better quadricep strength, and a shorter length of hospital stay. Let's wrap up this video and go over a few key points. Number one, maintaining a physically active lifestyle can help reduce the risk of post-surgical complications and mortality. Number two, implementing exercise before surgery can help improve post-surgical function. And number three, for those patients who are undergoing knee or hip replacement surgery, by implementing exercise before their surgery can help improve post-surgical function, strength, and length of stay. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my next video or in my office.